All right, so my patient today has a lot of fluid buildup. He's really edematous. So the doctor's ordered some furosemide to get some of that fluid off of him. I'm gonna drop my meds here first before I go in and take care of my patient. So I did have to change the order because it's ordered for 20 milligrams and I have a 40 ml syringe. So I'm actually gonna be drawing up 2 mils. Just wanted to show you the conversion of the math. So I'm going to take, first of all, my needle to draw up my medication. Oh, actually, before I did that, because this is a used bottle, I'm gonna take out my alcohol prep pad and I would clean the top of this bottle. Then I would pull out my medication. Okay. So basically it would be 2 mils that I'd be pulling up. Now I'm gonna cap my needle. All right, then, so I know actually what medication I have, I'm gonna label it. I'm gonna label this with my initials, medication, and dosage. So now, I'm gonna take off my needle, and I'm gonna dispose of this in a sharps container. This sharps container. Okay. So now, I'm gonna take my medication, and I'm gonna go in and give it to my patient. Knock, knock, knock. Hello, sir. I'm your nurse today, and the doctor has ordered you some Lasix. The reason for the Lasix is you have some fluid buildup, and we're gonna try to get some of that off of you. So I'm gonna bring your bed up to a good area, which is a very loud bed. And I'm going to ask you your name and date of birth. All right, are you allergic to anything? No? Okay, so we're going to use this port. And with these, there are no clamps. So actually really quick, let me grab some gloves. So sometimes on these ports, you're going to have clamps where you're going to have to clamp and unclamp during the push medications and flushes. But with these, you don't have to do that. So I'm going to take my alcohol swab and I'm going to scrub this port for up to 15 seconds at least. And while I'm doing this, I'm checking for any redness, any infiltration, anything wrong with the insertion site, and it all looks good from here. So this is my first saline flush, making sure the line is open. And I'm just gonna pulsate it as I push it in to make sure the line's still open. And that's a good line. It's okay. So I'm gonna flush the entire amount. And now I'm gonna grab my medication. So this is your Lasix. And with this, it needs to be pushed over 2 minutes at least. So while I'm pushing this medication over 2 minutes, I would try to educate the patient on some things to look for. So, sir, with this medication, since it's going to be getting the fluid off of your body, you'll notice that you have to go to the bathroom a lot, and that's normal. So, and you also need to watch out for like low blood pressure. So when you do get up, take your time and don't just jump out of bed, you know, in case because you might pass out. So just be very careful of that. Okay, so it's been over 2 minutes. I'm gonna take my last flush. We're gonna make sure we get all that medication out of the line and pushed into his body. You feeling okay with that? All right. So now that I'm finished with his medication, I'm gonna take these and throw them in the sharps container. Take off my gloves, wash my hands. This is my garbage area and sharps container. So coming back to my patient, I'm gonna make sure that he has his call light. So here's your call light. Oh, there it is. So if you need anything at all, push your call light, and I will be back to check on you shortly. All right? Thank you.